Alright, today we're going to be demonstrating two treatments, diathermy and iontophoresis. The first one I'll start with is iontophoresis. The equipment is a lot smaller than STEM, but this is just a portable TENS unit right here. You'd want to make sure that there are no cracks, anything like that on the equipment, that there's looks like it could function properly. Look at that, and take a look at the pads to make sure they're not torn in any way. Look at the wires to make sure they're not frayed or anything like that. And the syringe to make sure that it's sterile and no one has used it yet. And also to have the medicine out. For this particular treatment, we're using dexamethasone, which is a anti-inflammatory, but it's negative. After this, I would ask the patient if they've had any previous experience with iontophoresis treatments, and I would verify the presence of contraindications such as an open wound, pregnancy, or if they had a pacemaker in their heart. If they had any of those, we could not do iontophoresis on that specific area or on their body if they had a pregnancy or whatnot. Going to the patient, I would make sure that there's in a comfortable position for the treatment. Today we're just going to demonstrate iontophoresis on the arm. So if he's in a comfortable position for that, that would be fine for him as long as he's comfortable.
I thought I saw your legs.
So getting off the machine.
So, Tim?
I would expose the area to be treated. So just roll up the sleeve there as much as that can go. So.
What did you say, ice?
It's not comfortable.
Nope, we're good.
There's a towel here if they wish to have that.
Did it hurt when you did Wednesday?
We're looking at the machine. Hit the on switch. So that would turn the machine on. Right now it's set at S1, which is just standing for channel 1, this first setting, and then S2 would be the second channel, because you can actually do two iontophoresis treatments on this at once. So looking at that, we've got the machine on, we're on S1. The current is at 40 right now, and to determine the treatment time, you take the current times the treatment time to get the effect of iontophoresis. So that's at 40 right now.
That's fine.
I can adjust that to 35, let's say. And then I would switch it to P, which stands for just pause, basically. And that's where you can
And then you pick it back up?
up the time. Right there. There's the time. It's going for that amount. And then you switch it to R for resume, and then that would be the treatment time. There we go. So 25 minutes. So now we just hook up the machine to channel 1. We'll set this down here.
Yeah. Where does it hurt? Does it hurt in here? Or like down here? Say it's hard.
I was gonna say it's hard to tap.
Okay. It's not a long for anything, is it? You're running before?
So the use of these pads are different. This one is the medicine pad that you use the syringe to put it on.
It was like really low and for you, so it jumped, and the other time it was doing it that way. Which way did you do it?
So for a minute. And this is the other pad that you would use for the positive pole. How ionophoresis works, especially with dexamethasone, is that it's a negative analgesic, like it's a negative medication. So putting it on here, where I would stick this farther away on the extremity, say we're doing it down here and you want to stick it about a pad width away, I'd stick the other one here, and that would make it, so that the equipment would be being pulled, the medicine would be being pulled by the positive electrode down to the skin, so it has better rate of absorption. During the treatment time, I would just ask the patient about every 2 or 3 minutes how they're feeling. I would explain to them before that it's going to feel like a tingling sensation, almost wet, because the medicine is being absorbed to the skin, but it's not anything like getting a shot. So one thing I'd want to look for afterwards is chemical burn, which is the number one thing that can happen with ionophoresis treatments. And they might notice afterwards that their skin may be a little red, a little inflamed, but as long as it's not burned or scarred or anything like that, then it was okay. If that occurs next time, we can always lower the intensity of the treatment to adjust that so that they would not have that effect anymore. And after the treatment, I would ask them if they have any questions or anything like that about the treatment. I could be sure to answer those. And then after you're done with everything, just turn the machine off, switch it back to S1, and unplug everything. You'd want to unhook the cables from the pads. Make sure that the skin is wiped off and the pads are wiped off from any leftover medication. And just put that back in there. I think I forgot to add, before you start the treatment, you'd want to make sure that the area that is being treated is free of any oil, hair, anything like that, anything that would impede the ionter treatment. Usually just a razor could take care of the hair, or an alcohol swab could get the excess oil off the skin. And then you would just put the equipment back in the box, like so. Okay. Okay, now on to diathermy. For diathermy, we have a rebound machine. It's right here. And when starting this, you want to do the same thing that you would see in ionophoresis treatment. You want to look at the equipment, make sure that there are no bangs or anything, anything's cracked on. You want to make sure that the equipment is totally functional and doesn't look anything frayed. You want to make sure the sleeve is the same way too. I'd want to ask the patient if they've had any previous diathermy treatments, so they might know what to expect. Again, making sure that the patient is in a comfortable position. Usually with the sleeve that we have here, you would use it on maybe a calf, usually quadricep. So in a position that he's in, just lying here would be fine.
Scale of 1 to 10.
So looking at so now it's on. There we go. The machine's turned on. I'm going to set that over here for now. We don't want to fit the patient with the sleeve first, making sure that they have some kind of protective layer over the area that's being treated. It could either be a towel, sheet, or anything, even clothing, but you'd want to make sure that there's a protective layer of clothing over on it, because it does tend to overheat. So, just say you do your calf right here. You want to make sure that there's ample room in between the extremity being treated and the diathermy machine, because you don't want it to constrict and heat at the same time. That would really cause effects that wouldn't be desirable. Contraindications of this are, again, any open wounds, or any, if they have something that would suggest vascular compromise, if the skin is a different color, if they have anything like that. With
Okay, but that's it?
also forgot to include this with Ionto, but with any extremity treatment, you want to make sure that they have light touch perception. So touching down here, if they can feel that capillary refill for this area, I would check the posterior tibial artery, which is right underneath the medial malleolus, and just make sure that adequate blood flow. If we were doing the iontophoresis, I would have just checked his radial pulse right at the wrist, made sure that he could feel any sensation in his arm and things like that. So back to rebound machine. You have the machine on. For this case, we would be doing thermal effects with shortwave diathermy.
Real bad that I was having trouble walking.
So it's ready. We're at 20 minutes. It's at 100% duty cycle.
Before I ran.
So when did your piece start? Doing a warm up?
Yesterday morning.
And for this machine, we have to adjust the tuning.
It's a class day, so.
So, we did a workout Wednesday?
We did a workout Tuesday.
Or Wednesday?
No.
You get hurt during your front.
Eventually, until it
Guess it was Wednesday.
No.
So it didn't hurt until, yeah.
gets to the desired level.
You feel like deep?
Dude, hold your pants. What are you doing?
Operation was supposed to be done on my current lower thigh, right? Well, it was supposed to be, but we wanted like this whole. Oh, no, they did the knee. Yeah, that was what it was, that's what Dr. Hunt ordered. And I tried to get Matt to try to tell him to change it, and Matt's like, I'm gonna call him and see if they will, for like an extended view.
Yeah, they only did the knee and only went to, they didn't do anything else. So all it talks about is the fact that there's no movement in her knee, which is what her injury is. I was yelling at her, she feels like.
It's tender.
Lift your leg. Back. Wait, ready for you? Go away. Doesn't hurt your back. Okay, push your legs in. Back. Yes? Lean your back.
Not really. It's a little heartbeat.
Okay. Because of discomfort?
It might just be the area that we have.
I didn't know. Normal.
Away first. I'm not sure why it's not adjusting. Oh, there we go.
So you're using that part.
It's in a magazine, so it's gotta be true.
When I saw that, oh my gosh, was it just because?
There we go. Now it's in tune and ready to go.
On the top.
So now pressing that again, we'd put the therapy on and it would go for 20 minutes.
Did it start your quad or you need to
20 minutes at 100%.
Okay, and then you were.
It was mainly hard.
Drive a house out in
So after adjusting that, you just want to make sure that the patient's still comfortable. You want to see how they're doing, how it feels. If you need to adjust anything for them, you can do that on the go with the machine. I would explain to them it should just feel like as if they were getting heat wrap on, but it's more convenient because it fits around the whole extremity and you don't have to make it fit like you would do with a heat pack. So after that would be done, I can just push the pause button and then stop. I want to make sure the machine is stopped before I take anything off. And remove the sleeve. And then just check the area under here just to make sure that there aren't any adverse reactions and that he didn't get a burn or something like that. And then I would ask him if he had any questions about the treatment that I could answer for him. And that would be in diathermy non-apheresis treatment.